people who are accessing the rebate are making the choice to contribute towards their own healthcare, but don't have a high income to be able to fully cover the cost of their own premiums. If that money was to be suddenly taken away, they would seriously struggle. The participation in private health insurance would halve very quickly. We have modelling to show that. And these people would simply go straight to the back of the waiting list in public hospitals. And for some conditions, we know there isn't even a waiting list for many mental health conditions because they're simply not treated in the public hospital system. So of that $5.5 to $6 billion a year, the next thing we hear a lot of is that it could just be taken away and spent on the public hospitals. But we really need to unpack what that means. So what would it be spent on? It's very hard to know what would happen. And in fact, there is no guarantee that if that money was taken away, that one extra patient would be treated in the public hospital system. So what you do is you would immediately put 6 million people in the position of having to seek their care through the public hospital system. And there's no guarantee that there'd be capacity to treat one extra patient. At the moment, Australia arguably has one of the best health systems in the world, and the small investment that the government makes in the rebate, which is, under $6 billion out of a total $160 billion spent on health, I think is a great investment in keeping that high quality system viable. Barely a week goes by when I don't have to address some over-the-top urban myth about the private health insurance rebate. The first thing is that there's been a level of subsidy for private health insurance on and off for many years, in fact since the 1970s. The second thing is that the people that are accessing the private health insurance rebate are not rich, and I would refer you to the fact that the average income of people with private health insurance is $50,000 a year or less. The rebate is means tested, so it's not going to wealthy people, and it leverages a huge consumer contribution towards the cost of their own care for non-emergency surgery and for other conditions like the management of chronic disease, including mental health, chemotherapy, and many other serious conditions that the public hospital system has absolutely no capacity to absorb at the moment. 2/3 of elective surgery takes place in the private sector. 82% of day admissions for mental health and over 50% of overnight admissions for mental health take place in the private sector, and close to 70% of admissions for chemotherapy take place in the private sector.